So I think we are ready. Welcome everyone to the European Health Policy Pillar webinar on policy making. I'm very happy that you are all attending, and I don't know who has his mic still on sound. Could you mute yourself maybe, because there are some noises in the back? Thank you. So yeah, I hope everyone can hear me well, and yeah, I'm very happy that everyone is here. My name is Lina. I'm the European Health Policy Director, and I will be facilitating this webinar together with my three team members. Yeah, Paulius, would you like to introduce yourself?
Hello everyone, I'm Paulius Pavilonis. I'm currently the Assistant of the Internal Affairs for the European Health Policy Pillar.
Andres?
I'm Andres Eilers. I'm the Assistant for External Affairs for the European Health Policy Pillar.
And Jordan.
Hello everyone, my name is Jordan. I'm the Vice President of Internal Affairs for EMSA.
Perfect. So what are we going to do today? You probably already saw the agenda on Facebook. So first, there will be just a quick introduction to the European Health Policy Pillar and EMSA. Then Andres will outline the policy making in general and draw the line to the applied science of it. So how can we use policies, and what are they good for, and what can we do in EMSA? Yeah, how can we use these tools? Then we will have a short section on policy writing with some infos and tips. And also there will be a part about the policy making in EMSA. And in the end, we will have a Q&A section. And I would like you to ask questions through the comment section in the YouTube and the YouTube chat. We will at all time follow the chat, and we will keep the questions in mind and answer them in the end. So yeah, please do not hesitate to ask any question anytime in the chat. We will be happy to answer them then. So I will now hand over to it's my section in the beginning. The European Health Policy Pillar in EMSA is actually quite a new pillar. And yeah, I just lined out here the objectives of the pillar. So the Health Policy Pillar has actually like two sections. On the one hand, it is the health policy within the European region and the EU institutions. So we aim to target and actively engage in the current initiatives and projects that are coming up, monitoring the health policy platform, and also advocate for the topics that we are working on. So our focus areas of the pillar, they include the patient-centered healthcare, the working conditions of healthcare professionals, but at the moment, first and foremost, the health innovation and technologies, digital health, which is the European priority of the pillar. So the health policy pillar does have its own topics and focus areas, but on the other hand, we are also committed to raise awareness and educate medical students on health policy making on this European level, but also on policy making in EMSA, but also in your local structures, and just raise awareness for those topics there and provide a platform and kind of train and build capacity on those topics. So now I will hand over to Andres, who will give you an introduction to the policy making in general.
Okay, so next please. So we will just talk in the beginning of the dimensions of politics, just to give you a rough idea, like a theoretical background, because sometimes we just tend to confuse words and like what is politics again, like what's policy in the politics and what is polity. So therefore, I just wanted to go quickly through those kind of types, and so politics is the process where basically this different stakeholders, the members of organizations, they try to formulate and apply policies. So in a discussion or an argument, or they try to bring through their own ideas, and this kind of process where politics happens. The polity again is basically the institutional structure. So usually we call it state or government, or like ministry, for example. So just the structure in which the politics again can be applied. Like, it's not a chaotic world we live in, and just the loudest and the most violent person or members can advocate their policies. No, it's also like everyone has his rights. So this is the structure in which politics can take. And the policy again is the content of the political process. So that's basically the result, what is brought through in the politics. And as such a result, it can, like, you can find it in like plans and like laws and regulations and rules or guidelines, and this again can be applied on politics and polity. So, and this is changing like in a reciprocal way. It's changing like interchange and the three active dimensions basically. So yeah, this just that's the scope in which like policies function. Next, please. Okay, so policy science is like, unlike the traditional academia where you just try to find like the cause or the patterns of something. In policy science, you try to bring also more than that. You try to understand the cause of something, but then again, you want to suggest something something new. You just want to address the problem, and therefore the problem and the solution is so this relationship is just key. And you should never forget, it's always driven by some values, some motivates, some like by arguments like that are in favor of some parties, of some stakeholders. And in the end, you always try to convince someone by your ideas. And exactly. So this is it's not just pure cold empirism like in science, but it's always with a value in the background. Next, please. So, so this is like I will just go quickly through a policy cycle, so that you just get the rough idea like how like policies usually are applied. So next, please. First, you would define the problem, obviously. Like, just take the example of climate change or vaccination, anti-vaccination program, and like vaccination programs. You try to find the problem, obviously, and set it. Next, please. Then you construct a lot of like alternative possible policies. And for this, you need research and analytics. So this is like the backbone of a good policy. This takes a lot of debates and discussions, and in the end, you try to select, and that's the third point, you try to select one of the best solution, basically, and present it to governments or to some members or whoever. Like, for example, a 5-point action plan in climate change, or this would be that. And then you try to make a good design, like how would those guidelines look like? It's like from the colors of what you're using till like how you how you campaign for it, like, or like, is their campaign included or something like this. So the whole design process. And then the implementation starts. And next one. And after that, you monitor the process again. Like you try to find, has there been any updates? Is it all working the way you wanted it? And also, is the result the one you actually were looking for? Like if you, for example, press through some vaccination programs, and in the end, because you use a lot of, I don't know, you force people to vaccinate. In the end, maybe the results are just like worse than before. So that's, and then you have again maybe a new problem. And this is like the cycle, so it's always ongoing process. Next, please. So, what do we actually need policies for? Now we come a little to EMSA, but also like this is applicable for all the other organizations, students' organizations. Why it's so important, why we need policy statements. Next, please. So it's like twofold. It's like policies and policy statements. They are for internal work and external work. And the internal work is basically the education of members. You try to bring some new content to our people, and even maybe sometimes bring them into first contact with it. Like we had a survey about e-health, and we could see that a lot of people don't even know what e-health means, or they wouldn't know what primary healthcare means, or how transparency and universities work. And therefore, this is like the educational part. And the second one is the identity. So you like, by making a policy, or like by producing a policy statement, people like the members can relate to your content, and in the best case they would support it, and in the best case they would advocate for it, and that's what you want. And of course, it's giving you a direction where to go. And basically, it's always like you find it in the mission and vision. This is like the ground for it. And yeah, you know where you're heading to. And then there's the external work, of course, and it's it's the most important bit, like the advocacy for it. So you try to push and advocate your opinion, like not your opinion, but the opinion of the organization or the ideas. And if, for example, like there was an EMSA, we had an example where we didn't have any policy statement to the topic of antimicrobial resistance, for example. And then it's just not really possible to take part in debates and discussions. So therefore, it's also very good to have a lot of policy statements that people can actually discuss on behalf of their organization. And for that, to have a good discussions and to have a high quality in what you're saying, it's just very, very helpful that they prepare by your policy statements, because when you have good policies or good policy statements, they're just very high in reasoning, and yeah, you get a good knowledge, and it's just very good to have a very strong position, and plus, in the best case, very good evidence for this. And this is all included in really good policy statements. Next, please. This is your part.
Yes. Okay. So, yeah, thank you very much, Andres, for this general introduction and outline. So yeah, probably you might ask yourself, what impact can we actually have, or do NGOs as like organizations that do not really take part in like the decision-making processes? They are not the government that are then like setting policies into stone in like laws, for example. Like what impact can we have on those decision-making processes? And I just wanted to give you like a short example what a policy document or a policy statement can produce or can provoke. So probably you know about the Dieselgate, the affair about car manufacturers that manipulated their engines so that there has been a lot more air toxics that they have emitted. And there has been a policy document by the pulmonologists in Germany. They have outlined how those air toxics affect the health of people. And based on that, there has been a lot of recommendations and also prohibition of cars in German cities. Because it's bad for the health, and that was mentioned in the policy document. But then on the other side, there were some other pulmonologists that also made a statement and said, well, actually, that's not true, and other factors have a much bigger impact on your health. And you can see that here in the headlines that have that this has provoked a huge discussion about like what is right, and both sides could like use this for their argumentation. And in the end, it turned out that the second policy document was really not based on well evidence, and they couldn't really justify their claims that they make. And that's also leading us to the policy statement itself as part of the policy making cycle. So you need a good quality policy document if you want to meaningfully advocate. And that begins with a well structure or a good structure of this document. And I just noted you here the structure of the EMSA policy statements. And we linked you in the description of the webinar the template for policy statements, where you can find all the different sections, or like the structure of the policy statement with an explanation what contains what each section should be about. So I will just quickly go through it, and then you are very welcome to have a look at the template, and of course always approach us if you have any questions about this. But the executive summary is actually just a brief summary in the beginning, and it aims to provide the reader with an immediate overview about what you aim to do and what the problem is and what your basic recommendations are, or your main claims in the end. And then you have an introduction and background in which you lay out the issue, explain the question and the problem, and maybe also mention some examples or some other approaches or work that has been done previously in your organization on this, and why you are writing this policy statement. Then the discussion part is actually a very important part of the policy statement, because there you like justify your arguments. You have each argument, and you give reasons and evidence for the importance of this argument and why you are coming to the solution of recommending something on based on this. And those recommendations are then outlined in a very precise form in the recommendations part. And in the end, you have a conclusion, which should just also briefly summarize the recommendations, but it should not be the same as the executive summary. So the conclusion would actually be kind of putting the thing in context and really, again, strengthen your call on action. And of course, as I said, quality is very important and evidence is very important. So in the end, you list your references and provide definitions that you are using. And here I put it kind of in relation with the policy making cycle, because actually the policy statement can be put quite well into this structure. As Andres in the beginning said, it all begins with the problem and defining the situation, and that you are doing when you're writing the introduction and background. And it's very important to really outline the problem here, because then the reader gets the idea of the situation and also can tell why you are writing this policy statement. Then the discussion part would be constructing the policy alternative, but also like the policy itself, and already the solution that we are or that you are aiming at, which is then also in line with the recommendations that are kind of part of the solutions, but also the policy design, of course, like what actions should be taken. And that would be the policy statement. And the implementation in our case is, of course, the advocacy with this policy statement. So we implement the policy not in the form of a law or a directive on the EU level, but we are, as a non-governmental organization, we are adopting this policy statement and then can advocate on behalf of this. So we can go to external meetings and take a stance by saying all European medical students, all our members agreed on this policy with these recommendations, and that can have a strong impact. And the monitoring and evaluation is, of course, also very important. And so this also contains the up-to-dateness of a policy document. So in EMSA, they are only valid for 3 years. So you should have an overview about what policy documents are active. Is there maybe a new development, a new external factor, maybe a new law, a new regulation that maybe changes the problem so that you have to revise the policy document. So it's very important to always reevaluate and reassess the problem and the situation. Then
and in EMSA, so in EMSA, it's as we already said, it's actually like formatting or like giving the vision and mission. Like by doing the policy statements, we extend our view, like we extend like our content in our organization, and we vote upon those kind of decisions and the policy statements in the General Assembly. So this is we're speaking on behalf of our members, and that's of course very, very important when delegates of ours just are on a panel discussions, for example. We can't in that moment ask them, our members. So it's very important that we voted upon it, and this is the point. It's a mandate we have been given by our members, but in the same time it's obligation. So we are obliged to promote the ideas that have been given to us, and that's the importance of a good policy statement. Next.
Okay, so now Jordan will talk about the policy making within EMSA.
Hello again, and thank you for everything you said so far. I think it's really important to understand first how a policy, why anyone should write a policy statement, how they can use them, and really, it's really important what it includes. So there was a very good overview, and right now we can discuss how exactly this applies in EMSA, because this is one of the main purposes of the webinar. So in order to, first you have to understand that a policy statement in EMSA is active for 3 years and is adopted at the General Assembly. But before that, there is a process of writing a policy statement, sending it for adoption and voting on it. So could you go to the next slide, please? As we said already, it's the policy statements are one of the most important advocacy tools of EMSA, and they help our members in gaining skills and knowledge in policy making, but they're also a very useful tool for them. And they, in order to draft and accept a policy statement, it involves many people. It's drafted by leading authors, it's reviewed, and then it's voted on that. So it includes the European board and FMO members, and with the new policy making system that was implemented from last year from the European Health Policy Pillar, the facilitation of this process is done by the Department of Internal Affairs. Could you go to the next one so that I can explain the timeline? Yes, so as I said, with the new policy making system, now it's possible for anyone to be a leading author, really, in drafting a policy statement. So there, as maybe some of you have already seen, there was a call for a month and a half ago for leading authors, and the leading authors are the ones that pick a topic that they want to work on and start the drafting of the policy statement. And these topics, the initial propositions for these topics were made from the feedback from the last General Assembly. So this is how it's going to work in the future. When you go to assemblies, you can suggest topics for policy statements, and then there will be a call for leading authors that begin the drafting of these policy statements. After that, there is a call for contributing authors and reviewers, which include the European board and FMOs, which together with the leading authors begin writing the first draft of the policy statement, on any topic that they have chosen for themselves. So when this is done, you already have a first draft of a policy statement, and it's the time 2 months before GA is something that will be done now in the following days is a call for reviewers, which are the people that are responsible for completing a checklist and reviewing everything that's been written in the first draft and giving their feedback to the leading authors and the contributing authors. And one month before the spring assembly, in this case, so let's talk about the next assembly, the policy statement is sent out so that it can be included in the plenary document sent out after that. So the deadline for that is 1 month before the General Assembly. It may seem a bit complicated, but really it's a way to introduce EMSA members more in the process of writing policy statements and making the process more transparent. So anyone really can be involved in that right now, as long as you have the desire to do that. And can you go to the next slide? Yes, this is more a look into the internal rules. What you really need to know about that is that, especially when you go to first of all policy statements of EMSA are available on our website, so you can check them. But and as I told you, they're active for 3 years. But when you go to a General Assembly, for example, you also get a report from the EB for the current and expired policy statements, and 2 months after that for all active EMSA policy statements. And then this way you can follow which policy statements are active at that moment. Next one, please. Here you can see the duties of a pillar director in drafting a policy statement, but as I said, it's something that is not limited only to pillar directors. It's more includes as a whole the leading authors, but pillar directors are usually the ones that are working on drafting policy statements that are related to their pillars, and there are a few ones being written right now in different pillars. But you can follow the process in the quarterly reports, and you can get involved in the processes as well by filling out the calls that are for contributing authors and reviewers after that. Would anyone else like to add anything to what I've said before we continue, if I've missed something?
Well, I think we could maybe mention the policy documents that are currently that are in the writing process for the next spring assembly. There's the public health pillar will submit policy document on climate change and a policy document on vaccination. The European Health Policy Pillar will, together with the Department for External Affairs, we have worked on the topic of transparency and healthcare collaboration, so conflict of interest between the pharmaceutical or the medical device industry and the healthcare professions. Yeah, so that are basically the documents that I know now. Jordan, do you know another one that is
no, those are the current ones that will be proposed. So yes, thank you for adding that. And also, if you have questions regarding them, you can contact the pillar directors or write to me as well. But those are the current ones. So thank you for adding that.
Exactly. Okay, thank you very much, Jordan, for the outline. And then I hand over to Paulus with the tips for policy writing.
Thank you, Lena. So in my presentation, I'll give you some general tips for policy making that include summary, various methods to reach your target group, and be prepared in general. So first of all, we have to start with the purpose. As Lena already explained and went briefly of the structure, I would also like to make some notes that the purpose is very important, and this is why policies are made. So make sure to highlight the urgency of this and state significant findings of the problem based on your data. Then the evidence section, you have to show how you arrive to the findings, recommendations through various analysis of qualitative or quantitative data. Make sure you summarize your findings or state recommendations. So it could be provided by specific recommendations or findings in response to a specific problem, and make sure that you avoid generalizations. Generate criteria and identify evaluation will help you to is the key to assumption and methodology underlying your analysis, and prioritize your criteria so you rely on the essence of evidence. And if you are producing recommendations developed on theory of change, and analyze the options and trade-offs according to your methodology, assess their feasibility. For example, you can ask questions like, what are the pros and cons? What is feasible? What are the predictable outcomes? And etc. So it's to develop a logical model to grind your analysis and support your assertion in relevant data. Next slide, please. And it is also, although the executive summary is one of the most important parts of the policy papers, but it's also one of the most difficult one to write on. So I'll just share a couple of tips to have in mind. So as a general rule, the executive summary shouldn't be more than 5% of the full length of your paper. So let's say 100-page white paper might have like 5 pages executive summary. Might have a 5-page executive summary, and this is mainly rule of thumb. So your executive summary should be as long as it needs to summarize your key points. And I concluded 4 key points would be the motivation problem statement. So why do we care about this problem? What practical or theoretical or policy gap does your research address? Then the second would be methods, procedures, and approach. So what did you do to get your results? what methods do you use? For example, develop or analyze survey, analyze the legislative history of the issue, interview stakeholders, and etc. Also results, findings, and recommendations. As a result, your analysis, what did you learn, recommend, and for conclusion, implications, what are the larger implications of your findings? It could be also how do they help readers understand the problem, or let's say how do they help for the decision makers to understand the problem. So these are like the common structure for your executive summary. Next slide, please. So in this now I will share briefly some methods that will give you some support regarding your policy. So one of this is called PEST. It also has a little bit different names if you want to add more factors, but basically the opinion, the option and decision feasibility chart of PEST is the analysis. How can you locate recommendations in competing data and perspective? So it simply offers a starting point from which you can drill down to increasingly detailed conclusions and recommendations. So the first example that you see on your screens are the chart shows that the variability is a strong PEST analysis, breaking into the 5 categories to assess the feasibility of implementing 4 recommendation options: political feasibility, administrative feasibility, equity, cost effectiveness, and environmental impact. So the example chart focuses on the problem of pesticides, offering 4 possible policy options to control farm pesticide use. You can build your own feasibility chart by measuring options in the context of pest categories, and through the perspective of key interest groups. The more detailed your knowledge of subject, the more authoritative the outcome of the chart will be. So in this chart, the policy writer prioritized 5 hypothetical solutions to this problem of pesticides among the farmers. And this exact pest chart shows that while all 5 options have positive environmental impact, only one of the options predominates among the other criteria. So in your policy analysis view, the other factors, like in this particularly, the taxing pesticides meets the bar of being administratively feasible, equitable to all parties. So it has a positive environment and impact towards both cost-effective and offer positive economic impact. So for your policy writing, in this particular case, the taxing pesticides would be the best recommendation, which we'll highlight early in your memo. Next slide, please. And one more time. Yeah, thank you very much. So, and the second chart examines the same 5 possible options that we just discussed through the perspective of involving the interest groups, what we call the stakeholders. So the stakeholders chart shows that while all 5 possible options have both positive and negative aspects, once again, the solution of taxing pesticides dominates. So that means that when the option of the, like, let's say, taxing pesticides again shows up positively, the writer can feel certain and prioritizing that recommendation. It is a first step in clarifying your ideas before writing a policy paper. Next slide, please. So probably for a lot of you, you already saw this. This is very popular towards the non-governmental organizations, management, business strategy. This is the SWOT analysis, which means strength, weaknesses, opportunities, and threats. And it serves the surrounding environment of specific policy or strategy that you are analyzing or proposing. So basically, this method allows you to identify the internal characteristics of policy as either strengths or weaknesses, and classified external factors as opportunities for or threats. So it basically gives you your company or your policy paper a way to analyze both positive and negative factors that affect your policy now, or it could potentially affect it in the future. And after assessing and classifying internal and external factors, there's various ways you can do it. You can find the links in the description box. You basically can find the recommendations of where you have to strengthen and what kind of threats you can expect. Next slide, please. And here you can see the Minto pyramid. It is basically a reminder for you of how you should place your arguments. So all of your arguments would always follow the same structure. So that way your policy and the way you place your arguments would look solid. Next slide, please. And for the last slide, I just want to do a citation from Benjamin Franklin, which said that honesty is the best policy. So I wish you to be grateful when you come up with your policies, and I will give Lena to continue facilitate the Q&A. Thank you.
Thank you very much, Paul, for this inspirational quote in the end, and for the presenting this models and tools. Also, just for your information, the links to the models are also linked in the description of the webinar. And now we continue to the Q&A. So we collected already the questions that you asked in the chat. But of course, you can still ask questions now if you feel that something is not clear, or you have another topic that you feel that did not show, or a specific question on your local policy making. Anything, you can just share it there. So there was a question in the beginning whether this webinar will be recorded, and yes, it will be. It will be available on YouTube afterwards, so that you can also watch it all times. That's for sure. Then there was the question whether directors have an influence over the choice of topics. So maybe Jordan, you want to just quickly elaborate on this? I think you already answered in the chat, but
yeah, partially. But I want to say it again because that's important, actually. So the question was exactly if they have influence over the topics that are chosen, or is it mainly based on member interest? So both directors can choose any topic to write a policy statement on, which they find that's important for their pillar, and they can assemble a team with which they will write a policy statement. But also the member interest, as you call it, is very crucial to this new policy making system, because based on the feedback that's from EMSA at assemblies, there is a topic of policy statements that's gathered and sent out, and either bureau directors themselves can choose a topic that's been suggested by an individual member, and they can start writing a policy statement on it, or any other member can become the leading author of that policy statement. So so both bureau directors have make a choice themselves if they want, but also any suggestion from members is taken into account as well.
Yeah, I think there's also like a big point here is the policy cycle, so the reassessment of problems, because there are of course always a policy statement on important issues, but sometimes you reevaluate the situation, or a policy document is expired, and then of course the directors or the European board, the Department of Internal Affairs, has a better overview about what policy documents are to be revised or to be written. Or for example, also the Department of External Affairs sees some, like when representing EMSA at meetings, they see a new topic, a new solution, or a new problem that other external partners address, and they come and say, well, it would be good if we could have a policy document on that, because we would like to advocate on behalf of medical students there. So yeah, I hope this answered the question. And then there was a question by Selim. It was about how to be sure that the recommendations will be heard by external stakeholders, and how to contact them to represent our policy recommendations. And that is basically, this is always problematic, or not problematic, but the difficult part also, because there are, of course, in Brussels and at the European institutions, there are a lot of external partners or stakeholders that are advocating and that are like sharing their thoughts, that are claiming their positions. So as EMSA, we basically only have the chance to monitor these processes. And that is the task of the Department for External Affairs, but also the task of the European Health Policy Pillar. So we have the overview of activities on the European level, and we have to seize the opportunities and to see them and take them where we can make a statement on an important issue. So when we get invitations to external meetings, of course, there's the chance to present recommendations where that the policy documents are giving us. But also, for example, there was the WHO symposium on digital health in Copenhagen last week, and we didn't get an invitation in the first place, but it was our permanent officer got notice about this, or saw it actually only by monitoring, and then we could go, because we approached them and we said, well, we would like to represent medical students there. And this is, I think, the advocacy part is really to be separated a bit from the policy writing part, because it is then a different step, and it's also other people that are kind of responsible of it. As it's then the Department for External Affairs, the people that go to external meetings, the people that send out the policy statements after they got adopted. So as Jordan already said, after each General Assembly, the policy statements that have been adopted also have to be sent out to external partners. But the most efficient way to make our recommendations heard is to actively get involved on the European level and to be present at external meetings, and clarify the meaning of medical students there. And I think a strong opportunity, or like a strong tool to do so, is really by assessing the opinions of medical students through surveys. So to really base the policy documents on surveys that have been answered by a significant amount of medical students, and that's what we are seeing with the eHealth survey, for example. If you have the evidence, and that we are getting back to the evidence and the quality of policy statement, if you have a strong evidence and strong base to found your claims on and to justify your claims, they will be heard by external partners, and they are interested, and they would like us, and they take it also into consideration what we are saying. So I think that would be the most important thing.
Lina, may I add something?
Yes, sure.
I just want to say that to add to what you said about how make sure how we make sure recommendations will be heard. Just want to emphasize on what you said, actually, that every member of the EB that goes to an external meeting is prepared beforehand, and the policy statements are the documents that lead much of our external work. So we go to meetings and prepare ourselves in accordance to these policy statements, but also the policy statements, as you said, are a really powerful advocacy tool on a local level. So their power is in that they're voted by a General Assembly, so they reflect EMSA's vision and mission. So they can be used by any individual member if they can find a way to apply them, and that's what makes them so powerful. So it's really good if people get involved more and read them and try to use them more, because that's the way to forward the agenda that we put on for ourselves. And also I want to add that there is another question. When adopting joint statements with an external partner, how do we make sure both partners accept or vote on the same paper without amendments and everything? And I said, as far as my knowledge is, that we cannot control how external partners vote on policy statements. As far as I know, when they're jointly accepted or written, our obligation is to vote on them ourselves at our assembly, but we cannot control that external partners do the same. I guess we have to agree on that. And
yeah, I would
about
also,
joint statements,
yes, I think there's like no legislation for this. I think that's just an unwritten law that you don't, like, if you were in contact about a policy document and you drafted it together and it is a joint statement of your two association, that it's like clear to everyone that it's not going to be amended without the knowledge of the other association. So yeah, I hope that answers the question. Were there any other questions? Or I don't see the chat now, so.
Not at the moment.
Okay. So also the link for the template has been updated, I think, because the template for policy statements, the link did not work in the first place, I got to know. So I hope it's working now. If you don't have access, please request it and I will grant it to you. And I will also change the settings if it's not working. I will make sure that everyone can access it. But for now, I think we are through.
Just one more question. I'm sorry to interrupted you. There is one question the last minute. If as national EMSA members we want to send a policy statement strictly regarding problems on a national level to a particular government, we also have it accepted at GA before we send. So as far as I understand, the question is whether for a policy statement that's regarding a specific country, and that can be EMSA ratified, so to say. But the thing is that all policy statements in EMSA are on topics that are applicable to all members or FMOs. So I don't think a policy statement that's regarding only one FMO or one country, I don't think that can be accepted. I mean, such a local issue, I'm not sure, because anyway, to answer your question, in the end, any policy statement has to be accepted at the GA, that's for sure. But you can write a policy statement that's for your national member organization, that's accepted by your national member organization, if you want to use it to your government only. But if it's an issue that's on a European level, it can be suggested to and voted by EMSA members.
I agree, and I think also, of course, there can be policy statements on like some national issues if they are then important for the whole European region, or like if they are important for the whole association, for example, in EMSA, if it's somehow affecting the whole association, of course, there could be a policy statement on the situation in a national country, a national state. But yeah, as Jordan said, it has to be agreed on in the General Assembly. And yeah, I think that's what I wanted to add here. So if there are no more questions, I would like to thank everyone that has watched the webinar. I hope it was yeah, you gathered some knowledge and it was useful for you. If you have any further questions or yeah, a specific problem, or you're interested in policy making in EMSA but don't know really how to get involved, you can always approach me or Jordan. I think we are both very glad to answer any questions or help you with policymaking, also in your local structures, of course. And yeah, I think we are then through. I would like to thank everyone who has contributed, especially also Jordan, who helped us with the technical facilities and setting up this YouTube situation here. And also to Andres and Paulus for their contributions to the webinar. I wish you a good evening and a good start in the next week.
And thank you everyone for participating, and the European Health Policy team for the facilitation, because the topic is very important and the presentation is great. So as Lina said, if you have any questions, feel free to contact us, and we hope to see you at the Spring Assembly.
Yay! Goodbye.
Bye-bye.